I'm Dr. Pramod Reddy Kandakure. I am Chief Cardiothoracic, Aortic and Minimally Invasive Surgeon in Medicover Hospital, High Tech City, Hyderabad. I will explain today regarding what precautions you have to take after any heart surgeries. So one is when you get discharged after surgery, so normally little pain or cough or little breathing problems will happen because you are still recovering from the heart surgery. So you have to try to get back to normal as early as possible. So you have to walk gradually, and in a month's period, in a month's time, you have to walk about 1 to 2 kilometers daily. You can walk in the house or you can go outside after 10-15 days of surgery. Second thing, if you have done a conventional surgery where breastbone is cut, then 3 months you should not lift any weight apart from 1 liter of bottle or 1 kg of weight. If you have done minimally invasive surgery, after 15 days you can do all your activities. You need to, in a conventional surgery, we advise patient to use chest binder to protect the breastbone from cutting, because we use stainless steel wires to close the chest. So the breastbone, when you cough, becomes weak. So that is the reason it is additional support for the breastbone. So we advised to use chest binder for 6 weeks plus a spirometer where is the breathing exercises are done. So these exercises has to be done for 6 weeks so that the lung will not get infected, lung will not get collapsed, the lung expands and your recovery will be faster. The third more important is dietary changes or dietary modifications you have to do. You have to avoid spicy foods, you have to avoid oily foods or fatty foods, and regular exercises, regular walking has to be done to keep yourself fit. As and when we prescribe medicines, that medicines has to be taken properly. If you have undergone valve replacement, it's very important that you do the testing properly and you show it to the doctor, nearest physician or cardiologist, and then change the tablet strength depending upon what results you get. If the blood is more thin, blood is more thick, we have to adjust the tablet dose, and again we have to repeat the test regularly. If you follow these, your life will be good and nothing to worry. These are the common operations which can be done either conventional way or minimally invasive way, and your quality of life definitely improves after these types of surgeries. Thank you.